Hello, my name is Grant, and I will be presenting my virtual reality treatment for glossophobia, or fear of public speaking. To begin, the participant will be put into an observation room, looking into an empty version of the presentation room. This would allow the participants to become comfortable with the presentation room without having to step into the room. Once they were comfortable enough, and they were then encouraged to walk into the presentation room and up to the podium. From here, they were encouraged to start practicing one of the three presentations given to them, labeled A, B, and C, with A being the easiest presentation and C being the most difficult. All presentations consisted of three parts: an introduction, a body, and a closing. The body, or middle part, was supposed to be the most difficult and cause errors for the presenter, possibly increasing anxiety. For presentation A, it was count to 20, count backwards from 140 by sevens, and then count to 10. They were encouraged to read the script and then give the presentation, as to not give the presentation while looking at the script, but they were encouraged to look back if they needed to. After becoming comfortable with presenting to the empty presentation room, the participant was then encouraged to increase the size of the audience. They were encouraged to start with the audience size that would cause the least anxiety for them personally, as some people might be more intimidated by a smaller audience size, while some people might be more intimidated by a larger audience size. So to begin with, we'll start with a small audience size. This has one member in the audience. So the presenter would then present the script that he'd been practicing until he was once again comfortable, and from then on, increase the size of the audience. At this point, they could keep practicing the presentation they were given or move on to a harder presentation, like presentation B, which consisted of a scripted introduction, a riddle that will cause the reader possibly some errors, and thus more anxiety, and then a scripted closing. At this point, they could then increase it another time to the final largest audience size. This was supposed to elicit the most anxiety because this is a relatively large audience to present to. And then they could also present presentation C, which was more open-ended and had the participant give a general greeting to the audience that they had to come up on their own, tell the audience about their day, which they had to come up on their own again, and then thank the audience. This was more open-ended to make the presenter come up with what exactly he needed to say. A final version of the treatment consisted of participants giving a presentation to a smaller group size that is supposed to simulate a conference or a committee size group with their configuration. With all the various levels meant to be tackled in order of least anxiety provoking, which just starts with the observation room, then the empty room, then one member in the audience, and increasing members of the audience. Hopefully this would allow participants to become more comfortable with their skills and have less anxiety and fear when giving public presentations. Thanks for watching.